very interesting. I was always drawn to this technology. In 1992, when the robot had been out for 2 years, I visited the American Urological Conference and I attended the booth for Intuitive every day. I'd actually convinced them to bring the robot to Sydney and it convinced Marnie Menon, who is the father of really robotic surgery, to come over and train us. Unfortunately, that didn't work out. So during the next few years, I was always really interested in robotic surgery. I had kept in touch with the company, and fortunately we were very, very lucky in that the cardiothoracic surgeons were able to obtain the robot with the use of their donors. And John Davis, as a principal donor, was behind all this. And I was very lucky and privileged to be in a position where I could start the robotic program. I was chosen to lead it and pioneer it. And there was a lot of work and effort gone into it at the start. We spent a long time at home watching videos, role-playing it with the assistants and the nurses, and went through a lot of cases, dummy cases, before we did the first case. I think I was very, very lucky that I'd done a lot of laparoscopic work first and laparoscopic prostatectomy, so it was the same steps but a much more sophisticated bit of equipment. I did the first case and I did 70% of the cases in the first year. I was also privileged to train other surgeons and assistants with this procedure. I'm really happy to see that a lot of the urologists now have switched over to robot assisted surgeries, and it's clear that this is the way of the future. We've now performed over 600 cases, and I'm very pleased to say that I've performed over 350 of these personally. Studies have shown in the United States that you have to do over 200 cases to get excellent outcomes, and unfortunately I'm above that figure, but I do believe that we had a low learning curve because of my experience in laparoscopic surgery. The reason in Australia that there aren't more robots around, I believe, is because of the cost of the robotic system. You really need to have someone who helps the hospital in donation to get the robot, and also there's a significant learning curve initially when you start. So I've been, very, very fortunate to be in a privileged position, and I'm really lucky. I really have to thank, the cardiothoracic department and the donors who brought the robot.